Hello and welcome. You're watching Medically Speaking, and I am Meenakshi Upreti. Today, we will talk about an extremely pertinent topic, a topic which many are concerned with but don't know what to do about. I'm talking about something which is known as a modern disease, something which is related to a lot of our population. We don't take it seriously enough till it leads to other comorbidities. I'm talking about obesity. If you are extremely obese, almost morbidly obese, you've tried lifestyle changes, they haven't worked for you. Is it the end of the road for you? Perhaps not. There's something known as bariatric surgery, which has changed many lives. And today we will discuss what this bariatric surgery is, what it can do, are there any pros and cons of the same, myths around it, and a lot more. Let's open it up for discussion. I'm being joined by an esteemed panel, two doctors and one patient who has herself undergone this surgery. Dr. Poonam is joining us. She is the director of the Bariatric Physician Lab Pro Obeso Center of Pune. And I'm also being joined by Dr. Shashank Shah. He is the director and he's a bariatric surgeon. He's also from the Lab Pro Obeso Center at Pune in Maharashtra. I welcome you both, Dr. Poonam Shah and Dr. Shashank Shah. Also joining us is Alicia Thomas. Alicia is going to tell us what this surgery does. She is a testimonial, really. It's going to be a first-hand account of how this surgery, if at all, it helped her or not. Let's hear it, first of all, from the horse's mouth before I even go to the expert. Alicia, you have undergone bariatric surgery. Would you recommend it to someone else? If yes, why?
Good evening. Well, yes, I would. And I will tell you the story in as short as possible right now. My journey with weight loss, fighting against weight started when I was 19. And today I'm 44. So you can see how long the journey has been. When I was 19, I was diagnosed with PCOD and hypothyroid. And there was a steady increase in my weight. I kept fighting. I kept going to the gym, trying yo-yo diets, doing everything I could to lose the weight. But, I would lose some and then I would gain it back, and it kept on building and building and building. By the time I was 30, I had crossed the 100 kg mark. And it became increasingly difficult, not just in terms of health. Health was terrible because I wasn't able to walk. I would walk 10, 15 steps and I would start huffing and puffing. I wasn't able to sleep well. I had sleep apnea where I would snore really loudly at night, and I would wake up exhausted in the morning instead of feeling fresh. Along with that came shame and a lot of other things that is, a part of living life as a fat person, so to say. And it just started to decline more and more and more. And then my mother is diabetic. So there is a history of diabetes in my family. And by the time going to get diabetes too, because I was a born diabetic patient. And then I and kept everything I could. I went to yoga, but nothing worked. Then at the age of 39, when I realized I couldn't push this any longer, I bit the bullet. I visited Dr. Shah, and here I am today. I have lost 55 kilos after the surgery. I'm living a perfectly normal life, very healthy. And where I was told that I could never have kids because of my obesity and PCOD and so on and so forth, today I am the mother of a 14-month-old child. And I think that all happened only because I took the decision to have the surgery.
Well, that's extremely heartening, and many congratulations, of course, on having your baby as well. Shashank Shah, if you could come in here, give us a perspective before we open it up for discussion. exactly Dr. Shashank Shah, you're on mute by mistake. Can you unmute yourself, sir?
Thank you. So bariatric surgery is the word derived from the word baros. It means weight. So it was initially intended to lose weight. However, the understanding changed to changing hormones and improving metabolism. All these hormones which are linked to metabolism are secreted by curvature of the stomach, some part of intestine, and they are the easiest to handle. Similar hormones also exist in the brain, the liver, in the pancreas, but working on the stomach and intestines can always give a direct message to all other organs. So in short, bariatric surgery is changing the shape and size of the stomach, attaching intestines and rerouting the food to different part of intestine so that the stomach is stimulated, the intestines are stimulated, and the hormones which are in excess would come down like a hunger hormone from stomach or hormones which are required for weight loss maintenance or anti-diabetic action, like hormones secreted by intestine. They are known as GLP-1 PYY. They would be stimulated to be secreted in larger amounts because of the rerouting. Food reaches that part of the intestine fast. These are actually surgeries which were performed earlier. Maybe even there are reports of 1935, 1945, 55 that some operation on the stomach was performed. Patient lost weight, patient diabetes disappeared, but there was no correlation. And now the understanding has become better. So these are intestines or stomach and or intestine, which slowly improve your metabolism, reduce your hunger, increase your satiety or satiation, change your metabolism to utilization of fat and conversion to energy, and maintain your weight loss by increasing or accelerating your metabolic rate. This is in short bariatric surgery. They are keyhole, laparoscopic, performed by automated instruments, so they have become much easier, almost taken.
Okay. So you've given us the background on into what bariatric surgery is. Dr. Poonam Shah, if you could come in here, help us understand. Is it a magic bullet or is it a magic pill? Because there's a lot of myth around it as well. What if one wants to lose weight? Can one just get a bariatric surgery one day and go back to an unhealthy lifestyle, eat as many burgers and pizzas as they want?
No, actually, it's not so easy. Though it looks like a quick fix, it is not. This is a very scientific method, and it is the best weapon that a patient can get for substantial fat loss, substantial weight loss, which will improve the metabolic conditions that the person is suffering from, and it will improve the total quality of life of that patient. And these effects of bariatric surgery are like long term. There is no way that a person can have a very long term proper metabolic improvement and maintenance of the weight loss. So yes, though it looks like a quick fix, it is not a quick fix, but it works very well.
So after the surgery also, there is a long road to rehabilitation and a couple of precautions which a patient needs to take care, isn't it? Could you elaborate on those?
Yes. So, well, I can tell you that these surgeries are planned surgeries. So it is before surgery that the patient, the family is mentally, physically prepared to undergo this surgery. And post surgery, actually, the road is not so bad, it may seem, because it is just that the patient doesn't have any tubes on the day of the surgery, and the patient can, after a few hours, get up, walk around, go to the toilet himself or herself, and they start with little sips of water, and gradually, as their intake improves, the next day they are discharged, and then they just undergo a very slow process of going from clear liquids to proper food intake. The only thing which remains is that the quantity at one time that the person is going to eat is going to be less. And so what is important is how to fill in that little amount of food with good nutrition. So that is the role, of our dietitians and of course our physicians, where we need to just keep teaching the patient about good options to eat and how to get the nutrition in that little amount of food. So it is the understanding by the patient and the family to how to take care of oneself lifelong. So that is how it goes.
So of course it's a combination of many things, and even after surgery one needs to of course watch out what they eat. But Dr. Shashank Shah, if you could come in here as well, sir, since we're speaking of a surgery, what are the pros and cons of bariatric surgery?
Okay. It's a keyhole procedure. The benefits are immense. The person loses weight, joint pain disappears, infertility gets treated, blood pressure comes to normal, cholesterol comes to normal. All the load on heart, lung becomes less. So heart and lung, they start behaving better, they can function better and for a longer time. In short, it is called a life-prolonging surgery. It reduces cardiac events, it even reduces cancer. So if you look on the side of benefits, scientifically they are immense. Almost every system would get affected if there is load of excess weight or if there is load of hormones secreted by excess weight. Actually, this fat is now known as the largest endocrine organ in the body. Earlier, it used to be thought that fat is just an extra storage for excess energy, but now it is understood that the fat secretes various hormones, and these hormones induce inflammatory changes. They can aggravate asthma, they can induce headaches, migraine, kidney disease, and so on. And that is how the benefit is. The other side is it's a keyhole procedure. Patient has to commit to some lifestyle change for a long term. Patient has to lose. I must tell you that the hormones change in such a way that the cravings drastically come down. There is still satisfaction of eating. It is not easily possible for everyone to change the whole thing because there are other hormones, there is genetics. However, by and large, majority of the patients can learn to change what they want to choose in their routine diet and lifestyle. There is freedom to eat everything, but occasionally and not every day. So extreme of anything has to be controlled. Everyday abuse has to be controlled, but it is possible. And they definitely lose weight over a year's time. It is when they cross 4 or 5 years to be reminded you have undergone bariatric surgery. Your metabolism is not very healthy to support this kind of diet. Sometimes they can be helped with counseling, dietary advice, and some medication, and that is how the results can be prolonged. The other factor is when they eat little less or there is rooting of intestine, they need to take some vitamins. Vitamins have to be carefully monitored and taken for lifetime. But we definitely believe that a medication for diabetes, for cholesterol, for blood pressure, for painkiller, vitamin is always preferred. And in today's time, we definitely feel that almost everyone needs vitamin because overall the food is artificialized and unhealthy, and proper supply of vitamins to every individual is not possible. So vitamin supplements, watch on proteins, iron, and other nutrients is other care, which is the other side. I don't think it is very difficult, but the patient needs to be educated to take care of that.
Very important points which you are making. And Alicia, if you could come in here, help us understand what made you take this decision, and how did you decide that yes, I need this surgery?
It was a pivotal year of my life, really. Like I said, I was turning 40 that year, and my health was at its worst. Um, I was 125 kgs. I could hardly walk. I was not sleeping well. I was, very close to being a diabetic. And I said, if I don't do it now, um, I don't know when. So I addressed all my fears, and I met with several doctors before going to Dr. Shah because I was not convinced that this was, I'm a foodie, right? So I was not convinced this was the right answer for me, because I was worried that it might affect psychologically if I wasn't able to eat food or the kind of food I loved. But he was the only doctor who could actually convince me that, that is not the case. And I did it. And
Of changes self in your lifestyle, in your health after this surgery?
Okay, so over a period of about 18 months, I lost 55 kgs. My PCOD went away. My hypothyroid was in control. The diabetes was nowhere to be seen. I was able to exercise, run. I was able to live again. I mean, that I was able.
Right. That's a very big which you are making. You see, you were able to live again, Dr. Poonam Shah. If that's not, big. Right, right. Point taken, Alicia. There was a slight network issue with you there. I'll come back to you. But I'm taking the last sentence we heard. You said you were able to live again. And that, is very powerful expression, isn't it, Poonam Shah? Dr. Poonam, do you hear it often from your patients post the bariatrics?
Yes.
What's their experience like?
Yes, majority of patients say this, and of course that is a very satisfying thing to hear, and that is what is the intention of asking the patients to undergo these procedures, because the amount of fat loss or the amount of weight loss that is required for comorbidity resolution. Comorbidities are those illnesses which are associated with obesity. They may be the cause or the effect of the weight gain. But of these various disorders, like for example, diabetes, hypertension, sleep apnea, PCOD, as she mentioned, varicose veins, various hernias. So these do not revert, or you cannot get rid of these illnesses just by doing some diet and exercise. But the substantial amount of fat loss which occurs with bariatric surgery, so that helps in correcting these metabolic disorders, and that is what changes the complete physiology of the body. And so looking good, feeling good is like a good side effect of this bariatric surgery, so other than improvement in the metabolic parameters. So
Yeah, so
yes,
it's
we hear this very often.
not just cosmetic, isn't it, Dr. Shah? This bariatric is not just about appearances and looks. It has a lot to do with your health, isn't it, Dr. Shah?
Yes, please. It is absolutely not a cosmetic treatment at all. It is treatment of a disease, because obesity is a multifactorial disease. The benefits which the patient finds cosmetically or aesthetically better are: they become pain-free, joints become free, they are lighter, they can move faster, they can wear better clothes, more confident about themselves, because even depression gets treated. See, while you are standing on the stage, while you are walking, if someone is staring at you, even that affects their emotions. So they can wear better clothes. They are better appreciated by society, family, their partners, and everyone is looking at that. But even though these effects are seen, psychological comorbidities are also known as diseases associated with obesity. And it is a reversal of these diseases which makes the patient happier, apart from getting rid of most other disease conditions which are there. So this is actually offered to treat all those diseases associated with obesity, and then losing those diseases makes a patient live again and improves their happiness and quality of life.
Right. It's not just cosmetic. There are many other comorbidities. As Alicia was saying, she was borderline diabetic. In fact, in a similar panel, another patient said that they were suffering from many issues, and then the weight loss helped with other health related issues as well. But Dr. Shashank, what's the criteria? What do you look at when someone comes to you and says, Doctor, can I get this surgery?
The simplest measurement of excess weight or obesity is body mass index. That is in weight in kilograms divided by height in meters square. So we measure the proportion of height and weight, and if this measurement of BMI is more than 32.5, the obesity is known as severe obesity. That means the hormones and the metabolism have changed so much that standard modalities of treatment would not work, and body's physiology and hormones will act against them and continue to maintain that excess weight. In other words, anyone who is more than 20 to 25 kg overweight, or anyone has serious long-term life-threatening diseases like diabetes, blood pressure, high cholesterol, snoring, severe sleep apnea, disturbed sleep, depression, joint diseases, joint pain, heart disease, kidney failure because of obesity, and so on. So if anyone is affected because of their weight and the hormones in the form of these serious conditions, then the person needs aggressive treatment. And these are the ones who would be recommended to have laparoscopic, metabolic, and bariatric surgery. I am saying metabolic and bariatric surgery because it is actually not a weight loss surgery. It is a surgery to correct the abnormal metabolism to a healthier metabolism, abnormal healthier hormones, and that is how the entire change in the body to normal biochemical physical parameter would happen.
All right, that's a very important point which you make, sir. Dr. Poonam Shah, if you could come in, when we speak of a weight loss surgery, because a common man, when we speak of bariatric, they would think of it as a surgery which can help them lose weight, live a healthier life. But there must be a lot of myths around it as well, and I'm sure you have heard many of them. Tell us myths around bariatric surgery, and also tell us what is the truth. For example, I'll start with one. I've heard from many people, is it life-threatening? What's going to happen to me if I get this surgery?
Well, to come to think about this point, no, because these are planned surgeries. Like I said, the patient is physically prepared for the surgeries. Whatever comorbidities the patient has, whatever is uncontrolled, we try to control those parameters. Like if the sugars are high, or some the iron is low, then we try to correct these before surgery. So that is one thing, because they are planned surgeries, and so there is no problems during the surgery, even after the surgery, in any type of wound healing. And basically these are laparoscopic surgeries because they are just done through what is called as a keyhole surgeries. So there is not much of a problem of wound healing or pain. Another advantage is that in spite of so much weight and this thing, the patient is not in pain. The patient can easily get up, move around. So there is no fear of any kind in the patient's mind also. So the returning to a normal lifestyle is very easy following these surgeries, because of the advantage of good preparation and it being a laparoscopic surgeries, a good pain management. So it is very easy for them to get back to their feet, get back to their jobs. So yes, it has its good advantages in being well prepared surgery. So the risk is minimal. It is minimized totally because of good preparation.
Well, so a minimal risk surgery as well. Any other myth which Dr. Poonam you'd like to mention? Any myths which you have heard from your patient regarding bariatric surgery?
Is another thing that people feel is that you're going against nature. You're doing something which is whether it's right or not. Many people are therefore against surgery, but this is slowly changing over years. The thought process is now much improved, and patients do accept that these changes are the ones which actually correct your metabolism, which actually correct your physiology, which actually correct something which has gone wrong in the body. So it is now, the acceptance over the years is much, much easier than what it was when these surgeries were actually introduced say 20 years ago. So yes, that many of the myths which are surrounding the surgeries are now very clarified, and people don't think that way anymore.
And your myths. Yes, please go ahead.
And again, especially in younger kids, or kids who are obese, parents would think, no, this is like going against nature. Let's not put the kid through this. It will affect their milestones. In fact, it is the other way around. So giving the kid surgery in time growth of the child, with growth or with good milestones. So that is again a myth that kids or adolescent children should not be offered this surgery. In fact, in that age group, the treatment delayed is like a treatment denied. So it is very important for that age group also to be given the chance of this surgery if there are proper surgical indications, if they fit in the selection criteria.
And
So
obviously,
that is what parents should accept.
Dr. Shashank Shah. Alicia, if you come in, since Dr. Poonam was saying that the mindset is changing, people are appreciating it as well. What was the reaction of your friend, very close family, perhaps your partner or your parents, whoever you want to speak about once you got the surgery and the changes were palpable and visible?
So it was a mixed bag. While my mother supported me, the rest of my close family did not. They thought this was an easy way out or an escape route I was taking. Uh, they did not understand and see the kind of battle I had waged against overweight since I was a 19-year-old girl until I was 40. But my mother understood and she supported me. So I was fine and I did it. After doing it, when they started to see the change, of course, they appreciated the change. But I think there is a generation of people, maybe who are in their 50s and 60s, at least in my family, who still look at it as an easy way out. They don't look at it as something that is natural. It's been a process trying to explain to them that this is not an easy way out. This also requires a lot of discipline. It requires rigor. It requires, willpower to make sure that once you lose the weight, you don't gain it back. Your discipline, you're eating right, you're exercising, and so on and so forth. It's been a battle, but I've won the battle. So I really think it's worth it.
Very important point. And also, Alicia, since you say that a lot of people think it's an easy route, can you tell us that how it wasn't an easy route? It's not like you woke up one day and suddenly said, hey, I'm going to get a surgery. You had been struggling with, excessive weight. Also help us understand the type of mental toll it can put on people and how this surgery freed you when we speak of course, mental well-being as well.
It puts a huge weight on your mental frame of mind because you live with the shame of being fat. It's not fun when you go into a store and you try out clothes and nothing fits. Plus sizes in India came much later. There was a time when I had to buy all my clothes from outside the country because nothing fit me here or get them tailored. It was that bad. It's been very, very difficult as a fat person on a daily basis. Even my friends would make fun of me. Even they would say stuff in jest. There was a point in time I used to make jokes about myself to not feel bad about other people making jokes about me. It was that bad. So that's the kind of mental toll it takes on you. And no, it's not a decision I arrived at overnight. My best friend had been angling me towards this for 5 years, and I kept saying no because I was not sure if I had the willpower to give up food. Food was my comforter in times of shame, in times of sadness, and I didn't know if I could eat normally after doing the surgery. So it took me a really, really long time, a lot of research, meeting several doctors, and then meeting the right one. So it's been a long journey.
Right. And I'm glad that, you met the right doctors, got the surgery, and are leading a much healthier and happier life. And I think very important point which you say is, of course, the mental well-being, which many don't talk about. That's something which Dr. Shashank also said. We spoke of comorbidities, but even I, to begin with, only spoke of, say, cholesterol or diabetes, the toll it takes on your mental health, the type of course, how you would have felt mentally after getting the surgery. All of that combined is a plus sign, which you are, of course, highlighting at this point of time. Dr. Shashank, though, there is one question I'd like to ask. Are we having a conversation sitting in our ivory tower in a high throne in silos away from the reality of our country? There are many who perhaps can't afford expensive surgeries. Is it covered under insurance? Is it covered under, say, Ayushman? Or if someone wants to get it redeemed, post the surgery? Are insurance companies covering it? What is the approximate cost? Does it take a huge economic toll on the patient?
Very interesting question. And I must say, it is possible to offer this surgery to anyone and everyone in the country. Insurance does cover the surgery. Those who undergo surgery and want to reimburse, they are totally reimbursed by insurance company if they have a valid insurance in place. Let us think why insurance company would like to pay it. I'll give you an example. Someone has to undergo 2 joint replacements and still cannot walk. Someone needs spine surgery. All these patients, if they are untreated, eventually insurance company will spend more on many other operations, disease condition, many admissions. At the same time, the toll it takes on the overall productivity of a person's ability to work for longer time. Because after this procedure, patient's energy, enthusiasm, capacity to work for longer time increases drastically. These surgeries are being proposed to be covered in the Ayushman or similar schemes in the country. It will take some time, however, they are available in medical colleges. Central government health schemes also cover it. And I must say it's a long struggle to get this covered under insurance, and they are covered in all other countries in the world. It took some time for our country, but in last 2 years, thousands and thousands of patients have got this benefit of getting a cashless surgery or getting reimbursement and enjoying the benefit of insurance for better health.
Right. And, last 2 years also, Dr. Poonam, have been a little difficult because all of us were sitting at home, the gyms were off, people had a very sedentary lifestyle. Again, many of us are foodies. Weight gain is a big reality, and for many it is related to comorbidities. Many we have discussed through the length and breadth of this program. Any word you'd like to say to them as we are reaching the end of our program? We're left with about 10 minutes or so. Anything you'd like to say to those perhaps who are suffering with excessive weight, have worked out, have tried everything, but it's not working for them?
To say is first thing that understand obesity is chronic disease. Just like we accept hypertension, diabetes, we should understand that this is a chronic disease and therefore it needs to be treated. Bariatric surgery is best options for a good substantial fat loss with correction of the metabolic parameters as well as improvement in the quality of life. So this is an option that people should accept. So that understanding is very important for everybody, and this is irrespective of the age of the person. Do not deny this treatment to any age. That is what I would like to say.
Very important. So as you said, from younger generation, even children, it can go up to, of course, the elderly, depending on their condition, which doctors assess. Alisha, from your experience, last word, anything you'd like to say as we close the show? Those who are perhaps skeptical, are researching. It took you 5 years. I'm sure many others are still confused.
I would say don't take this long. Life is beautiful when you're fit, when you're happy, when you're feeling confident and good about yourself. And overweight does not any of those feelings day-to-day basis. What you feel is really shame, exhaustion, and all of them. Nobody deserves to live with those kind of feelings. So if you've tried everything and it's not worked, you should just go for it. Don't think about what the world thinks. Think about what your body deserves and what you deserve.
Important point. And Dr. Shashank,
That's all.
anything you'd like to say as we close the program? We're asking for, the last message from your side for the audiences watching the show, sir.
So I see that it was generally thought that those who are suffering with obesity are lazy, they eat a lot, and that is why they are obese. And science has definitely established that obesity is a disease. It's a complex disease. It's not a choice. It's not just a lifestyle disorder. So it needs a scientific approach. It needs scientific treatment. And scientific treatments are in different phases. Very early in your phase, you have 6 to 8 kgs of excess weight. You can try dietary changes, lifestyle changes, which are always necessary. If there is little more excess, maybe 10, 12, 15 kilograms, You can try with medications, diet, exercise. It may work at that time. Once you cross that, maybe endoscopic treatments, balloons. Once you come to severe obesity, which was earlier known as morbid obesity, but I do not like to use that word. I would say people who suffer from a disease of severe obesity, and if they fit into the criteria of bariatric surgery, maybe adolescents, maybe elderly, at every age they have a right to get their diseases treated. And if it is scientifically approved and fits into the criteria, everyone should follow evidence-based medicine and guidelines and take the benefit of bariatric surgery if they qualify for it.
All right. Thank you all for taking us through, what bariatric surgery is, what are the pros and cons, busting myths around it, and of course, to Alicia, who explained the first-hand view. What better than hearing, what a patient underwent, what their journey was like. I hope after this show, many of you watching, perhaps someone is undergoing a similar issue like Alicia, can take a more informed decision, if nothing else, at the end of the day. Thank you so much for watching. And I thank both the doctors and also, of course, Alicia for joining us on the show.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.